Hi, so my name's Helen Coleman and I work in the partnerships team in NHS Hampshire and the Isle of Wight. And I'm here today, it's Stoptober, and I'm here today with Luisa to talk about Stoptober and all the things that we're doing. So hi Luisa, could you introduce yourself?
Hi, Helen. Yeah, sure. So I'm Luisa McLaughlin, Population Health and Health Inequalities Officer, and I work as part of the Population Health team in NHS Hampshire and Isle of Wight. And we're really excited to be supporting Stoptober, helping people to kind of get the right support and help them to quit smoking.
Great, so what services are available to help people stop smoking in Hampshire and the Isle of Wight?
Yeah, so we've got lots of tailored support available in Hampshire and the Isle of Wight. You can self-refer to Smoke Free Hampshire, Smoke Free Ireland, Portsmouth Wellbeing Service. Southampton's a little bit different. It doesn't have a kind of one-stop shop for stop smoking support, but you can self-refer to your local pharmacy or your GP. But I think kind of the best way that I would recommend to figure out what support is kind of closest to you and what works for you is just by going onto the nhs.uk/better health website, and that kind of gives you an insight as to what's going on in your local area that would be able to best support you.
Right, okay, yeah, so it's helpful so information is available there to signpost people.
Yeah,
That's great. So are there some good examples of things that are going on that you would say is good practice in our patch?
yeah, absolutely. So at the moment, Portsmouth, for Stoptober, they're kind of supporting their It's Well Worth It campaign. They're offering drop-in sessions 3 times a week until the 14th of November. Evening sessions, 4 till 7 p.m. I think it's a Monday, Wednesday, Thursday. And I'm going to head along next week to one of the sessions and just see how they're getting on, kind of interact with the public a little bit, which I think will be a really great opportunity at the moment during Stoptober. Um, but again, I would just reference that nhs.uk/better health website for more information. There's lots on there about that specific program as well. I think also another local example would be Hampshire hospitals are looking to have Smoke Free Hampshire attend their hospital site to support patients, but also trying to support the staff, which I think is a really
Mm.
great opportunity just to reach out and kind of bring the service to the hospital as well, which is great.
Yeah.
Um, I think also just thinking about our maternity services, they're showcasing lots of great work, and our data in that area is showing that our smoking at time of delivery rates have reduced, which is really great news. And we're doing really well with lots of midwives trained across the patch to provide support as well.
Oh, it's really nice to hear so much going on.
Mm.
Um, so thinking about that, how do we compare with us in Hampshire and the Isle of Wight with other places in the country? Are we doing well, or do we need to do
Yes,
more?
yeah. So kind of looking at us as an ICB, um, we're doing well. Our smoking prevalence rate is joint fifth at the moment out of all the ICBs. So this is data from prevalence data from 2023. We're sitting at around 10.4%, and the England average is 11.6, and we're aiming for less than 5% of the population to be smoking by 2030. And from an NHS pathways perspective, kind of across acute maternity, mental health, we've got 50% of services fully established. So just looking at kind of how our patient pathways are and can they get support that they need to access the stop smoking support as well. So um, yeah, it's looking really good so far, looking promising, but work to be done.
Yeah, no, that's great. Like you say, we can't be complacent, can we? So
Mhm.
you mentioned a few things. Is there anything else that we're doing to try and sort of really get those numbers down?
Yeah, so we're definitely looking for those opportunities to reach the smokers, um, because it's kind of the low hanging fruit of who we've already um, been able to interact with, and just trying to get that 10.4% lowered. Um, so we're just kind of continuing to work with our trusts from those the same settings, acute maternity and mental health point of view. There's obviously just been the trust merger with Southern Health, Solent, and Isle of Wight Mental Health, and we're in conversation with them about kind of improving access and support, and just looking at that as a great opportunity to grow. And I think also just continuing to link with our public health colleagues who we work really closely with, just collaboratively, just helping to support our local populations, really. So yeah, I think just trying really hard to improve and work towards that at the moment.
That's great. Take up every opportunity we can. Right,
Exactly.
lovely. Well, thank you for joining me and talking about Stoptober and all the things that are going on. Thank you, and goodbye.
Thanks, Helen.